I want the candy down there and the cheese.
Oh, okay, we're
Okay. Now that we've divvied up the food committee, we are back live. And I've had it on my. That our previous witness did not show up because she had some form of automobile accident, but was able to call a tow truck, so, and call us, so we're assuming she's okay. We'll have her back. But we're going to take a look now at S51 and Senator Hardy. This is an act relating to the Vermont unpaid caregiver tax credit. Okay, Senator Hardy.
Thank you, Madam Chair. So I just wanted to give you all some backstory. I've talked to a couple of you about this bill, or many of you about this bill, but sort of backstory on why I wanted to introduce this. One is because I've spent the last 4 years on the Health and Welfare Committee, and we get a lot of testimony from people who are caring for other people. Some of those are nurses and doctors who are paid for their work, but a lot of them have been testimony from regular, quote unquote, regular Vermonters who are caring for relatives, or in some cases friends, and not getting paid for it. And often those are people caring for their elderly parents or their children who have severe disabilities or chronic diseases, including people who are caring for adult children with disabilities, spouses with dementia or cancer or whatever. And we heard lots of testimony on the toll this takes on people financially and physically and emotionally. So that's sort of stuck with me. And we got some particularly good testimony, and I'm going to give a shout out to the person behind me, the Alzheimer's Association, hi Meg, about for the toll it takes on people who are caring for their spouses or family members with Alzheimer's. And so that was one of the things that got me thinking. And then, of course, I and probably everybody around the table had personal experience with caring for somebody. I know the chair has, and I had at the same time caring for people who, my mother and your daughter, you know, the toll that it takes when you're not, especially when you're not financially able to do it. And so thinking a lot about that, and then knowing that in the building, there's a lot of interest in finding tax relief. And how can we help Vermonters to afford to be in Vermont more and more? And also knowing the statistics about who are the people most likely to be living in poverty. And the people most likely to be living in poverty are older women, women over the age of 55. And last semester, last fall, I taught a class that Martine Sanadula came to visit, and I've taught it a couple of times before about public policy and gender. And it was a lot about how different types of policy affect different, you know, can be looked at through a gendered lens. We talked about tax policy, and then we do a mock Senate session at the end where my students introduce bills, and then they do a lot of research and work, and then they debate the bills and do committees just like we do. And it's really fun and they have a great time. And one of my students introduced a bill about an unpaid caregiver tax credit. And so I want to give my students credit. They were part of the inspiration for this, and the findings in the bill were based on my students' research. And that's why as Ledge Council knows, I don't generally like to include findings in my bills, but I did this time because my students came up with the findings. And so you can really see that the findings show that, you know, based on Labor Department, women in the United States ages 55 and older provide $26.6 million of unpaid care to family and friends. And then there's more and more statistics about the sort of the population that's most likely to be an unpaid caregiver. I want to make clear, and I explained this to some people as I was asking people to co-sponsor, this isn't just eligible. Only women over the age of 50 or 5 are not the only people eligible. You can be 22-year-old man caring for your mom and not being paid. And if you meet the income category, you could be eligible as well. So just want to make clear, it's just that they're most likely to be older women who are eligible, which is a population that really needs a lot in our state. And a couple of years ago, we did a child tax credit in this room. And that was targeted at families with children under the age of 5 and under. And it had certain income categories. And so this is modeled off of that tax credit for how it would work and which income levels would be eligible for the tax credit. It is a refundable tax credit, meaning that people would get the money, even if as long as they file their taxes. I started at $2,500 as a credit, which is generous, I know, for somebody spending at least 20 hours per week providing uncompensated care. And then there's some definitions about the individual who's being cared for and some information about the income levels and how the credit would work. I also want to note that this is something that's that other states are looking at. I think Legislative Council or JFO, one of them, or both of them maybe, who are sitting behind me, said I think there are at least 7 states where this is passed. The first state that I know of is Oklahoma. And they do a slightly different, you can do it a little bit differently in each state. There also is federal legislation. I think it's called the Credit to Care Act, or Credit for Caring Act or something like that. So, and in all these states, it's been a bipartisan or, multi-partisan effort. So I would just wanted to have this on the table as part of our conversation about tax relief and how we can approach it. So that is my intro.
And my introduction has Patrick and then Kirby. Is that?
Kirby Clippers.
I thought, and then you're going to tell us what it costs, right? Kind of, sort. All right. So Kirby, come on up. And while you're coming up, I'm going to ask Meg, does Alzheimer's still do funding for respiratory care? When I was working with Alzheimer's patients, there was a program where you got help paying for respite care. So I had one caregiver who would go to Maine for the weekend on occasion just to get away, and it was a lifesaver.
I believe that's the dementia respite grant that in the state allocates $250,000 and it goes out through the AAA. So
Okay,
we have it, but it's very small.
AAAs.
I believe it
All right.
served 134 people last year before it ran out of money.
But it is,
But it is
it's a
still,
real lifeline.
it is a huge lifeline.
Okay. So Kirby, welcome back. I thought you took up residence in this room last year. We haven't seen you this year.
Thank you. Yes, I'm always busier second half of the session.
We will
So,
see a lot of you, I am sure.
so Kirby Keaton, Legislative Council. I handle the tax portfolio. For those who don't know me, I have a couple of new senators that I'm actually well acquainted with.
This is where you spent the first half of the session.
Right. So it's great to see everybody. First time in Senate Finance this session. And we're gonna walk through S51. So the bill starts with some findings. Would the chair like me to read those or skip those?
Why don't we read those? I
Okay,
think that would be a good thing to have on the record.
okay, so there are 4. So the General Assembly finds, 1, according to the U.S. Department of Labor, women in the United States 55 years of age and older provide 26.6 million hours of unpaid care to family and friends daily. The second, according to AARP, more than 75% of family caregivers 50 years of age and older who retired early because of family caregiving responsibilities would have remained in the workforce longer if they had access to financial or non-financial supports. Also, according to AARP, if family caregivers aged 58 years of age and older have access to support in the workplace, US GDP would grow by an additional 1.7 trillion in 2030. Number three, according to a 2023 report by the Urban Institute entitled Lifetime Employment-Related Costs to Women for Providing Family Care, the employment-related costs for mothers of providing unpaid care to minor children and parents-in-law and spouses, including unmarried partners, with care needs average $295,000 over a lifetime. So that's the cost to them. And number four, using a national survey and 6 focus groups, the Commonwealth Fund identified financial compensation for the time spent caregiving as a top policy priority for family caregivers. And that brings us to the statutory purpose. As I'm sure all of you know, Vermont law requires every tax expenditure to have a statutory purpose. So the statutory purpose for this credit would be to provide financial support to Vermonters who spend significant time providing uncompensated care for a family. And that gets us into the language of the credit itself. So this is, as Senator Hardy mentioned before, a refundable personal income tax credit. That's for resident individuals or part-year resident individuals, which is typical for these kinds of credits. The way it's set up is that there's a maximum credit of $2,500, but it's prorated by month. So the way it would work functionally is you would take that 2,500 and you would divide it by 12, and for each month that the claimant qualified, providing 20 hours per week and meeting all of the other requirements, they would get that much credit.
And I'm assuming that has something to do with not impacting other. We did this once before. I guess the child tax credit, if you got it all at once, you lost your SNAP benefits or your child care benefits for that month. That wasn't what you were looking at.
It wasn't
Okay.
what I was looking at, but we certainly could talk about that because I had forgotten. I remember that conversation. But this was mostly just to determine how much the credit would be,
Okay.
especially if they're part-year residents or might be just taking care of
Okay.
somebody for 4 months out of the year or something like
Okay,
that.
so this is on the what do you get, not,
This would be so that you wouldn't get a full credit if
Okay.
you only provided care for 1 month. So
yeah,
it's a way to prorate that.
okay,
We'll get to a phase out later, which the phase out is based off of the Vermont child tax credit. So there is part of that inspired in here. So, okay, getting into the requirements for the credit under the bill. The first requirement is 20 hours per week of uncompensated care for an individual. First requirement. Second requirement is that individual be related to the claimant by blood, civil marriage, or adoption. Third requirement would be that the individual needs assistance with daily activities, home health care, or assistance for remaining safe at home. Fourth requirement would be that the individual has a medically diagnosed disability or health condition. And the last requirement is that the person cannot reside in basically a nursing home. If they're in a nursing home. Okay. And then, so what's that?
All 4 must be that.
All of these must be met to qualify. One thing to know, my background is I worked in the Department of Taxes for a while, and I think about the administration of things, and I feel like, if you keep pursuing this, I'm sure the department will come in and say, give their opinion. But I feel like what they would talk about is, well, can we administer this? What's trackable and what's not? And there's parts of these requirements are trackable. Like you could provide proof of the marriage or blood relation. You can provide proof of a medical diagnosis. And some of the others are harder to prove as far as the administration goes, but there's nonetheless requirements for collecting credit. All right, so subsection B, starting line 18, is the phase out. This phase out is just like the child tax credit. It starts phasing out at 125,000 of AGI for an individual. If you have a jointly filing status, it's still 125, which is like that credit. And then it spaces out $50 for each $1,000 of AGI over 125. So that means a hard cap at 175, no credit. In that case, one thing to note though is we don't have language in here limiting the credit for two claimants for one individual. That scenario could exist. Hmm.
Two parents, one kid.
Let's say you have two parents, one kid. Under this language, if they're filing jointly, that's one credit that could be
Okay.
claimed. They could file separately and each of them claim a credit, but they would have to qualify independently. They would each be
Okay.
providing 20 hours each per week.
Okay.
What about the other way? Like say a husband and wife taking care of mother and mother-in-law, one person, but they each do 20 hours a week of care.
So the way it's written, it's the same thing.
Then
You would have to file separately if you want two credits,
gotcha.
but it's allowable.
Hmm.
Okay, and subsection C. There's also, the subsection C is to require attestation when claiming the credit. To meet all the requirements. And then also, this isn't necessary. This would be something the department could do anyway under the law, but there is a provision upfront about how the Department of Taxes can inquire and ask for documentation to support some of the eligibility. And it's discretionary for the department. So if the department decides they're uneasy about looking into sensitive information, it doesn't mandate that they do that. And for the effective date, it's written to be effective starting next year when people file taxes. So it would be for this current tax year that's going on. But the first time it could be used would be next year when people file.
That's standard. Okay, any questions for Kirby? Pretty straightforward.
Yep.
Okay. You feel like you're on the hot seat?
Well, let's see. So Patrick just enjoyed fiscal office. While it might be very straightforward from Kirby's perspective, it's a little bit less so from
Okay.
our perspective. And the reason just being, so the first thing I try to do is identify the entities or the population we're talking about that would be eligible for this. There's some in the findings, some information specific to this, the limit over the age of 50, right? A little more broadly, AARP says that there's 70,000 unpaid caregivers in the state, doing about 66 million hours of care. So if we do that on an average basis, 943 hours per caregiver per year. And just to give a sense of where that sort of fits in with the 20 weeks, 20 hours weekly, the minimum you need to be doing is 1,040. So basically, according to those findings, it's like on average, they're kind of just coming in below that cap. So with the prorated basis, maybe on average, they'd be getting 11 out of the 12 months instead of the full 12. But one thing that's a little sort of makes me sort of think about that 70,000 person population actually does tie back to some of the definitions. So, you know, it's survey data, it's all self-reporting, right? What's not included within that is, you know, they might not be providing care specifically to a blood relative. It could be for a close neighbor or a close friend or something like that. So I don't know sort of what piece of that puzzle is made up from those situations. And also, I don't know within those ARP figures where sort of the medical diagnosis sort of fits in with, you know, if the person that they're providing care for has some sort of explicit medical diagnosis or, you know, something I saw when reading the Canadian sort of definition for a very similar type credit is they call them infirm. So presumably sort of housebound, limited mobility, that kind of stuff. So that's sort of the first thing I look at. The second thing I try to do when something might not be sort of tracked federally or at the state level specifically, and we don't have sort of good picture of what the population would look like, is I'll look at other states that have a similar type credit. And, you know, just like we do, a lot of them write tax expenditure reports where they actually detail the filings, and what that costs them, their state. So ideally in those situations, I'll try and find a state that has something structured very similarly. So I had one funny comment about the Oklahoma thing, like their version of the credit. And reading through it, they have an interesting cap of $1.5 million per year that it can cost. And basically what my reading of it is, they're going to go in and adjust the benefit amounts each year to sort of actuarially try and hit that target, which I haven't really seen that in the world of tax credits before. And that was kind of
It's Oklahoma.
makes it more predictable, I guess, from a budgeting standpoint. But yeah, and the other thing that's different about how a lot of those are structured is they base the credit on eligible expenses. So basically, if you're an itemizer, you can include those expenses in your itemization and claim the credit that way. Now, the thing with itemizing, though, typically it's people with a lot of tax liability or higher income people who have a lot of expenses to be able to itemize. You'd really be kind of cutting out some of those lower income individuals if you were to take that particular type of approach. But, you know, that in my mind, that must be one way that Oklahoma's getting that cap down to 1.5 million. And so then the other thing, I also looked at Canada, which they use the definition of infirm. They don't have sort of the 20 hours a week stipulation, but it is basically a flat credit amount based on you providing this care to someone who's a blood relative, right? And so where that's useful, that like a couple things different, like I said, they don't have the time requirement. And also the income threshold is much lower. But just looking within their universe of total tax returns and like within that income group who's claiming, it's about 4.8% of their sort of population income group.
Level somewhere around 48,000 a year.
Well, so then you bring me to the next good point. The income thresholds for this bill, which are higher, they encompass about 88.9% of Vermont resident tax returns. So 89%, that's just a hair under 300,000 tax returns. So it's not going to be perfect, like one-to-one comparison, which is where, you know, it's definitely more so skewed towards the lower end of the income spectrum, right? Their particular credit. If you're higher income, you're probably going to be claiming at a lower rate because you likely have the ability to pay instead of providing some effect care yourself. So it's difficult to argue that you could just overlay that 4.8%. I think Canada shuts off at like 25,000, and here we're talking 175,000.
They shut off at 25,000?
Around there.
Wow. that's
Yeah,
really
so it's
low.
Well,
really-
about 48, because that's where you start paying the 50% income tax. It's under 48. So but that Canada is very generous in its social programs, but everybody pays.
But I mean, so this wouldn't be an appropriate approach to take, but if we just overlaid that 4.8% over the income spectrum in Vermont, we're talking about 14,400 tax returns. Just to give you sort of a general sense of the scope here, I think sort of as we, you know, I'm going to definitely be talking to the tax department and seeing and getting in touch with these other Department of Revenues to see what their take-up rates look like. But I think, you know, right now, when you said, oh, you're going to show us the numbers, right? I gave you a little bit of a face because I think right now the number, sort of working number I have is neither instructive nor helpful.
70,000. Yeah, people, that brings you up a little short.
Yeah.
But what AARP is that over 20 hours a week or?
I don't think that that includes that stipulation, which makes sort of, that is sort of it's both, I think Kirby mentioned it, maybe one of the more difficult things for the tax department to track. But it's also sort of a caveat within this that makes it difficult to overlay it with some of this survey data, because that could involve someone doing 5 hours a week, to someone doing 10 hours every other week, to someone who's full-time caring
Yeah.
for.
I mean, I could see, because if one partner is staying home and not getting paid and the other is sick, then this would have to be for a limited time or you wouldn't be making $125,000 a year. It could be a child that's sick. I stayed home with sick children a lot, but I wasn't staying home from work. I was just home. So we weren't losing money. And that is a rarity these days. So you could do 20 hours a week for a kid that's recovering from surgery or has the flu. Or COVID or any one of those things, but something like COVID could really kick these numbers up too. Just to stay home for any kind of a disease epidemic.
Yeah, I think, that makes me think of, I guess in that situation, you want to start thinking about what the intersection between this and a paid leave program might look like.
Yeah.
Because one thing about other states where they are giving the credit if you're an itemizer and have those expenses to claim is they're sort of tracking out of pocket costs. But another thing, sort of the way I see some of the structure of this being put forward is that it's trying to get at sort of the opportunity cost of time, the time you're spending doing the care.
Right.
So it's sort of a policy sort of consideration for you to think about, which angle kind of want to approach it from,
Yeah.
which in this case, it does seem to be addressing that opportunity cost of time.
Yeah, and I think a large part, people who are not able to work because they have to stay home and take care of relatives or have to cut down their hours. I'm thinking of testimony specifically that we've gotten from people who are taking care of relatives with chronic illnesses who, had to stop working full time, only work part-time because they have to take care of their relatives. And so that's the opportunity cost. It's like literally a cost. And so trying to compensate for that.
How would this mesh? We have a program, I'm forgetting the exact title, where the Medicaid, I believe, you can hire your caregiver. The idea when we started it was that you could hire your spouse who was staying home to take care of you. That
That'd
was
be a paid caregiver.
that would be a paid caregiver, but I wonder if they would meet the, I'm sure they're under the $175,000 threshold.
But if
They
they're
were
being
paying
paid,
something like but that's what I'm wondering, would that disqualify?
I would think because this is specific for people who are not getting paid to be caregivers.
Where did the 125,000 threshold come from?
That's the child tax credit threshold. So the thresholds and the phase down is based on that.
And that's for children under 5. I guess the proposal this year is to raise that to 6.
Yeah.
But that was the thought that's before you put your kids in public school, and that's when the most caregiving costs come to parents. Either they stay home or they pay for childcare.
Yeah, and that was another motivation of mine was that's a tax credit that is really focused on younger families. And this is more likely to be focused on older individuals.
Or all those parents who are now aging out, who've been taking care of severely disabled children.
Yeah,
And, they are not able to work, definitely not able to work part-time. And we've been trying to find some supportive housing options for those folks. If you have Alzheimer's, you're bad, you can't work. Which is what Adult Days provided, was the ability to work and have them. But we haven't gotten back the Adult Days that we had before COVID, and there weren't an adequate number that.
The child tax credit, two parents can't claim the same kid, but in this case, if both parents, two people, both are spending 20 of their own hours, they both be able to.
Right.
as it is structured right now, as long as they're filing separately.
As long as they're both spending 20 hours of their time.
Yeah, not filing jointly.
They're each working 2.5 days a week.
Would you think this might incent more filing separately? And do we care about that?
To the extent that it helps, I mean, this isn't the only consideration people would have to file separately, but to the extent that, you know, they can identify that they'll owe less in taxes or have a bigger return by doing so. You know, if their CPA identifies it, I'm not sure why they wouldn't steer them in that direction.
But you may lose other benefits by filing separately, so they're gonna
Yeah,
talk to.
I mean,
the
it
tax-
changes the entire sort of filing structure with all the
Yeah.
other credits or benefits you might be eligible for.
Every tax filer will be different. Because every circumstance will be different. But it is definitely, we should have your student in.
That'd be
Because
great. We'd love to have my
I mean-
come testify.
have her testify, or yes, she. Because this shows some work, it does identify a group of people who do a lot of care. This is cheaper than doing family.
I know.
Which we haven't been able to do,
It's a different angle on the same problem, I think.
but it is something. And so, yeah, see how that works and.
Maybe I missed it. Is there a fiscal note or expectation of how much nice to work on that?
Needs to work.
Well, I'd say sort of my comment on that would be, as the conversation continues and maybe some of those definitions are maybe tweaked or more refined, that where I can identify this population, I'd be able to, like I said, I have a number right now, but it's neither informative or instructive for you all.
Didn't notice that.
And that's what I'm not saying, this, the only thing people ever remember is the number.
Yeah, it's true.
Yeah,
You know, how much I have on it.
yeah,
Right, and I'd rather hear from tax first. I talked with them really briefly, but I think it would be helpful to have them come in and.
okay, so we will ask the tax department to come over and talk to us about. Basically, could they implement this? I assume they could. It sounds like the medical diagnosis may be. A little difficult. You gotta have a doctor's note, I guess. And fresh, to look at how the Canadians find infirm, but they have a very low. But they have paid family leave, so I assume. That you could qualify for paid family leave if you were tearing.
And their credit's also not refundable.
It's not refundable, so it is a pure tax credit, okay. Okay, and for the $10,000 in Canada is. Dirt poor, I mean, that's
There's cuts off at 25,000.
a 25,
Well,
that's
that's
still really poor.
And I do think it's layered on top of other
Yes.
programs.
That's
Yeah,
a fancy
yeah.
voucher.
Yeah. But yeah, that is not a lot of money. It's everything costs twice as much, even before we went to Congress. We launched, and it's, I'm hoping it ends.
So it's,
Go back. All right. Other questions for Kirby? All right. Anybody else that would like to testify? See me, see Charlotte. We'll ask Tax to come in.
I'll ask my students. Thank you, Madam Chair.
Yes, ask your student if she can zoom in, if she wants to.
She might want to come.
That would be good. She should be here to see us voted.
I would love that.
Uh-huh.
We did vote.
We used to have a school, I think it was Twinfield, and they had a student who, a teacher who every year would have the kids develop a bill and present it. And we, the one I know was a success was, providing a scholarship for students who were foster kids
Oh,
because they didn't have parents to help them pay for. That one got voted through. They had another one they talked to us about, which was taking the reference to Christian religion out of the Constitution. We had a few discussions about why that might be more politically difficult.
the US Constitution?
No, the
Oh.
Vermont Constitution.
A 12-year-old would like to bring chocolate milk back to the school.
Yeah, that's like every middle school has that.
No chocolate milk. And the one we heard is that they are eating a lot of free meals. But the one complaint is that the proportions are too small. And that was federal, I think, and I can remember there were a lot of complaints when it went in. Because it's the same proportion for a 90-pound girl and a 200-pound linebacker football. And the linebacker was being forced to buy 2 lunches.
As a larger individual, I think that's a worthy subject to talk about.
Have some cheese. Right, I got cheese.
He's supplying the candy and the nuts and berries.
The raw